So I came here to be a leukemia doctor, and within the first 18 months, the two individuals who were doing bone marrow transplantation left, and so at a very young age, I was told that I was in charge of the bone marrow transplant program, which at the time was very, very small. And over the next 15 years or so, I kind of built it and grew it and led it. So I was a leader back then at a pretty young age, even though I really didn't know anything about leadership, and I just kind of winged it. And I assumed that I was doing fine. The program was doing very, very well, and we were starting to generate, a lot of accolades nationally and even internationally. And then, I don't know, about 15, 20 years ago, the organization started to devote some time towards leadership, and actually I had some opportunities to lead some other things. And hearing that there was actually a literature about the topic, about that there's books written about leadership, was kind of interesting to me. And then I was part of a small group of people who were selected by our CEO to have kind of some formal leadership training. And one of the things that happened was I was assigned to executive coaches, and they underwent a pretty thorough 360. A 360 is when people who work with me or for me are asked in a very confidential environment what they think about me and my leadership skills. And sometimes these things are done online and they're kind of impersonal, but my two coaches didn't mess around. They went and they talked to everybody and met with them for an hour, and they came up with a document that was about 25 patients that basically told me everything that I was doing wrong, which was really, really enjoyable to read. But it was really, really good because, again, I mean, you kind of think that you're doing a pretty good job, and when all of your flaws are I mean, not only did they give me this document, we went over it line by line, so they kind of punched the point that there were a lot of things to work on. But again, it was great feedback, so fair enough, so you acknowledge that and you say, all right, I want to be better, how am I going to get better?